Broadcast is now starting. All attendees are in listen-only mode.
Good morning. Thanks for joining us today for our webinar. My name is Carmen Boone. I'm an education coordinator for Oregon Pacific Area Health Education Center, and we're a hosted agency of Samaritan Lebanon Community Hospital. Our agency mission is to promote access to quality health care through community and educational partnerships. Today, I'll be your host and moderator. Let's go over some housekeeping items. Your microphones are muted. Please keep them muted, and they will be muted throughout the session. Please use the Q&A for questions. And if you can see the chat, use the chat for comments at any time. And you can ask questions at any time as well. We are going to be recording this webinar, and it's going to be posted on our YouTube channel. We will be emailing you the link for our YouTube channel. Contact us if you have trouble seeing the handouts and downloading them. We'll be happy to email them to you. On the screen, you can see my email address right now. And please email me if you would like a copy of the slides. Now, for those who want to obtain a certificate of attendance or CME credit or contact hours, you will need the activity code on this screen. And you must log into www.eeds.com and enter this activity code. Please write the code down for your records and consider that the activity code expires in 1 week. We will be emailing you all these instructions, links, and YouTube channel information today within an hour or two after this webinar. This presentation is jointly provided by Samaritan Health Services, the Oregon HPV Alliance, the American Cancer Society, and Oregon Pacific AHEC. The presenters and the planners of this activity report that they have no conflict of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. This webinar is presented by Maddie Sand. She is a rising junior at Cornell University, studying biology with a concentration in human nutrition and a minor in American Studies. She is originally from Wesleyan, Oregon. Maddie is passionate about rural health in Oregon, stemming from her time spent in Douglas County with her extended family. In her free time, she enjoys caring for her flock of chickens, running, and spending time with family and friends. Now, without further ado, it's my pleasure to leave you with our intern for this summer, Maddie Sand.
Hi, everyone. Welcome to the Introduction to Oregon HPV Vaccination Week webinar. Let me get my slides shared for you. I'm really happy to introduce the Oregon 2021 HPV Vaccination Week Toolkit and the Oregon for the HPV Vaccination Week, which will be happening this year from August 16th to 20th. This webinar is designed to help you, our HPV Vaccination Week partners, plan and implement a wide range of successful activities during HPV Vaccination Week. This webinar was built out to provide resources for engaging your community, your staff, your clinic, and beyond. And we hope we can continue to charge our advocates with information about HPV vaccination. As Carmen so kindly introduced me. My name is Madeline Sand, and I'm really interested in this being a collective feedback-oriented and engaging webinar. I don't want to be just presenting to you, but rather we are here to have a conversation with you about the 5 goals of HPV Vaccination Week. And I hope that this call can be a gateway to your successful partnership in helping us with the 2021 Oregon HPV Vaccination Week. The goals for this webinar are simple. We have 5. The first is to understand the goals and missions around HPV Vaccination Week. This webinar is a tool and an introduction into Oregon HPV Vaccine Week. And what does that mean? Well, hopefully this webinar can answer questions you have about Oregon HPV Vaccination Week. Our second goal is to analyze data on HPV vaccination and HPV cancers here in Oregon. Together, we will look at vaccination data for Oregon, for county, and for individual counties, and provide resources and tools for you to dive into in your own clinical data. We'll also go over some basic facts and key points to our week in HPV cancer prevention. Our third goal is to access tools and resources to improve HPV vaccination rates. If you've utilized the Toolkit, talked with your ACS staff partner, attended an HPV summit, visited our Oregon HPV cancer-free webpage, or anything in between, I'm certain that you've seen a variety of resources on HPV vaccination. And we wanted to be able to give you a one-stop shop for the top resources in cancer prevention. We will be going through available guides in a variety of settings. Our fourth goal is to strategize participation in Oregon HPV Vaccination Week and beyond. You've decided that you're interested in participating, but you're unsure what that looks like, what you could commit to, or what you could be involved in. My job today is to spell out and provide resources for 4 key evidence-based interventions. And our fifth is simply to raise awareness on the importance of HPV vaccination in every community. So let's get to sharing the news on that HPV vaccination is cancer prevention and what was already created and how we can raise awareness. If we can get through each of these goals, I'm confident that together we can create a generation that's free of HPV cancers. Now, before we dive into our goals, I just wanted to make sure that you're aware of 2 dynamic resources that are available right now. The first is our Oregon HPV Vaccination website, which is linked on this slide. And the second is our Oregon HPV Vaccination Week Toolkit, which is available for download on this same website. We have a vision. Our vision is to create a country that is HPV cancer-free and to create the first generation free of vaccine-preventable cancers and to someday have a world without HPV cancers. And it's never been easier to achieve this vision. Our first goal is diving into Oregon HPV Vaccine Week, its vision and its reason. In short, we have a collective goal and role for everyone. Eliminating HPV cancers, which can bring people together on a national, state, or even a local level. And who doesn't want to prevent cancer? I think we all do. So the work starts with each of us. Oregon HPV Cancer-Free is calling you to action in the fight against human papillomavirus, which is a group of diseases that are linked to 6 types of cancers and other diseases. We are asking that you join us in the fight against HPV, starting today by improving HPV vaccination rates in Oregon. And we invite you and your organization to help us with this by participating in the 2021 Oregon HPV Vaccination Week. This year, the vaccination week will be between August 16th and the 20th. And if you're marking your calendars right now, you'll see this also overlaps with the Northwest Immunization Conference, as well as the National Immunization Month of August. Now, by instituting system changes to improve HPV vaccination, your system or organization can improve vaccination rates and, in turn, reduce future suffering, lower the costs that are associated with treatment, and ultimately save patients' lives. And I think that's the most important part. When HPV Vaccination week was proposed, the goal was simple. We are excited to see that we have many partners involved. I'm going to read our goal to you and really highlight the pieces that speak to us. The goal of the Oregon HPV Vaccination Week is to reduce the number of HPV-associated cancers by supporting an improved vaccine uptake among adolescents in Oregon through both education and collaboration. Together, we will reduce the number of HPV cancers and we will improve vaccination rates. And all of this can be done through both education and collaboration. But we cannot do this work alone. We need partners like yourself to engage in this work. And today you are here, which is the first step. You showed up to learn, and we are really thankful for you joining us in HPV Cancer Free. Now, by working together, this will have a lasting impact. How exciting is it to think that you could be part of a generation free from vaccine-preventable cancers? Now, we know that each region, community, and jurisdiction has its own set of challenges, opportunities, and systems to tackle to improve HPV vaccination rates. Regardless of which educational or collaborative initiative you take, we are delighted to have you as an official or potential partner. Oregon HPV Vaccination Week has two key audiences to reach. The first is parents of adolescent boys and girls in Oregon with a special focus on rural communities. And the second is providers who see adolescent patients and work with them to make a strong and effective HPV vaccination recommendation. And why are we targeting these two groups? Because typically, increased parent knowledge will reduce confusion and increase HPV vaccination. Because HPV vaccination is cancer prevention. Our number one message is that HPV vaccination is cancer prevention. And you'll hear me say that many times and make it very clear that that's what's important to us. It's also key that we strengthen provider recommendations. The biggest predictor of HPV vaccination uptake is an effective recommendation from a healthcare professional, specifically someone who is in family medicine or in the pediatric profession. Now, I can assume that if you've joined this call, that means you're interested in engaging in this work. And if you're committed to the vision of Oregon HPV Cancer Free, we consider you a partner in the 2021 Oregon HPV Vaccination Week. On the website, there is a page and tab for campaign partners. And when you become a partner, you first show that you support the ACS, the Oregon Pacific Health Education Center, and the Oregon State Immunization Program for the Oregon HPV Vaccination Week. Secondly, you inform others you are working on increasing HPV vaccination rates. And finally, you state you are a local resource for any community members that may have come across this site. If you would like to be highlighted on this page, please go to the OregonHPVCancerFree.org, download the pledge, and send Carmen your signed file at carmenb@samhealth.org. Now we'll dive deeper into future slides, the expectations of our partners during HPV Vaccination Week. Our second goal is to analyze data on vaccination and cancers in Oregon. Now, we possess a significant amount of data in the state and regional level around HPV cancers, vaccination rates, and gaps between those rates. And much of this data can be found through the Oregon Health Authority or on the ACS's own dashboard. We look at data with our local partners so we know where to place our efforts to address gaps. We can have a mutual understanding of disparities and opportunities within our community to create for a high impact. And partnerships and collaboration allow us to work smarter, not harder. And that's why this work around HPV vaccination in Oregon through the Oregon HPV Vaccination Week is so vital. We can collectively understand our mission and make our goals for our clinics, systems, communities, and state. I always say that you have to know where you are to know where you want to go, and we can't do that without data. HPV vaccination is expected to prevent 90% of HPV cancers when given before the adolescent is exposed to the virus. The vaccine helps prevent infection with the most common types of HPV that can cause cervical, throat, vulvar, vaginal, penile, and anal cancers. The vaccine also protects against the types of HPV that cause oral cancers, and studies show that a majority of cervical and anal cancers and up to 90% of genital warts can be prevented with this vaccine. Now, thanks to the Oregon Health Authority, we have a great deal of data for the state of Oregon, as well as the counties in Oregon around HPV vaccination rates and their uptake. The vaccination rate, according to May 2020 data in Oregon, is 55%. Now, it's important to know that HPV vaccination rates from the first dose of initiation to up-to-date series completion to county data and comparison to other vaccines, as well as many other resources, can be found through the Oregon Health Authority data. And knowing your rates will help drive your planning and intervention process, and it's critical before beginning any intervention that you connect rates to key messages of this campaign. So on the next few slides, I'll share key messages we are highlighting during HPV Vaccination Week. Our first message, and probably the most important, is that HPV vaccination is cancer prevention. This is our number one message, and communicating this message will create a generation free of HPV cancers. The HPV vaccine is best given before the age of 13 to provide the most complete coverage against HPV types that cause cancer. That's why we recommend that both boys and girls get the HPV vaccine between the ages of 9 and 12. In this webinar and in our toolkit, you'll find a plethora of resources supporting the information on HPV vaccination for a variety of audiences. Now, a second key message we are highlighting is that the HPV vaccine is safe and effective. Studies continue to prove that HPV vaccination works extremely well, decreasing the number of infections and HPV precancers in young people since it was introduced. Now, more than 270 million doses of the HPV vaccine have been distributed worldwide, with more than 100 million of those doses being in the US. Like with all vaccines, the HPV vaccine is constantly monitored, and these studies continue to show that HPV vaccination is safe. And a special resource to review if this is something you or your providers are hearing from parents can be found on our website, and it's called HPV Vax, just the facts for providers. The third message that we want to make clear is that this vaccine is for both boys and girls. HPV vaccination is strongly recommended for males and females. Vaccination helps to protect boys from getting infected with the most common types of HPV that can cause cancers of the throat, the penis, and the anus. Vaccination can help protect girls from getting infected with the most common types of HPV that can cause cancer of the cervix, throat, vagina, vulva, and anus. We are also trying to highlight that the best age for administering the vaccine is between the ages of 9 and 12. The HPV vaccine provides the most complete protection against HPV cancers when the series is complete before 13. And that's why it's recommended that boys and girls get the HPV vaccine between the ages of 9 and 12. Vaccination can start as early as 9. And if all 11 and 12-year-olds were vaccinated, an estimated 90% of HPV cancers could be prevented, amounting to more than 31,000 cancers each year. And there's a great resource you can review and share in your clinic specific to this topic called Don't Wait to Vaccinate, which can also be found on our website. Now, please note that although the FDA has approved the vaccine from 27 to 45-year-olds of age, it has not yet been voted on by the ACIP. There is no knowledge about the coverage or practice changes in this group until the ACIP votes. And therefore, it's extremely important that both boys and girls are vaccinated between the ages of 9 and 12 to protect themselves from preventable HPV cancers. Now, this slide shows Oregon vaccination rates by county. And the Oregon Health Authority provides this map for many years. And so you can see how vaccination rates have changed in the state over time. One of the elements you'll see on this map is that counties with lighter colors have lower vaccination rates versus counties with higher colors have higher darker colors have higher vaccination rates. As you can tell from this slide, rural Oregon has less of an uptake for the vaccine, and we are really focused on how we can eliminate this gap in care. What are steps that we could take as a state to increase this uptake? Knowing data, especially the data presented on this slide, is extremely important in answering these essential questions. You must know where you're at to know where you want to go. Whether at a clinic, a county, or at a state level, data can help determine your planning and intervention process. And for HPV vaccination, knowing your data means determining baseline vaccination rates. On a state level, this is calculated and shared through the OHA. On a health system and clinical level, calculating baseline rates of patients who have initiated or completed the HPV vaccination series is crucial before beginning any intervention. And a helpful resource for determining this in your own clinic or smaller, more local level is the HPV Vax report card. And it's a great tool that you can use to calculate and communicate your rates, set goals, and monitor your progress over the course of an intervention. And you can reach out to the ACS or contact for this resource and for personalized support on this work. Now, in addition to knowing rates and understanding baseline data, HPV vaccination is cancer prevention, and those are key points to understand as a health advocate. This webinar is a gateway to tools that can be available to your team. To increase HPV vaccination, we need to enlist everyone in this work and share the message of cancer prevention. One of these next few slides, you're encouraged to absorb this information and to share it with your teams. Now, first, we want to make clear that human papillomavirus is so common that it will affect most people at some time in their lives. It is estimated that about 4 out of 5 people will get HPV. Infections with HPV types that cause most HPV cancers in general warts have dropped 71% since children first started getting this vaccine in 2006. The HPV vaccine helps prevent the infections of 6 types of cancers, and the HPV vaccine is given in 2 shots 12 months apart, and doctors recommend that girls and boys get vaccinated against HPV between the ages of 9 and 12. The vaccine can also be administered up to the age of 26 for women and 21 for men, but the longer you wait, the more shots are necessary. Make sure to write down any questions you have so you can ask them at the end of this presentation regarding the HPV vaccine series. Now, the third goal of our webinar is to help you on deciding which steps to take during HPV vaccination week and beyond that. Oregon HPV Vaccination Week is already in process, and we have 3 phases to this project. You can sign up as a partner, and we are in this stage until and during HPV Vaccination Week. But it is our hope that most partners are already engaged by the time that HPV Vaccination Week rolls around this year, from August 16th to 20th. And right now, we would be in what would be considered phase 2, which is planning. We want to support your system in planning an intervention that would be effective for your patient population. And our third long-term goal of this project is to increase HPV vaccination rates. And we hope we can celebrate the amazing work being done throughout the state. The Oregon Health Authority recently published this amazing resource for strategies on increasing HPV vaccination. If you haven't seen this document, I highly encourage that you review this after our call, and I've highlighted some key points for a clinical level strategy in this slide. But in short, what we really want to reduce is missed opportunities and use specific language that is proven to work to make sure that all of our systems are aware of their vaccination rates. And we'll talk more about each of these steps in the coming slides. Now, our biggest hope is that your partnership in HPV Vaccination Week means you'll implement a targeted and timely evidence-based intervention and system change. System changes should be made as necessary to support and sustain HPV vaccination interventions. Evidence-based interventions for HPV vaccination include provider education, patient reminders, reducing barriers, and engaging with clinical champions. A refresher on what evidence-based intervention is a program or policy or strategy that has been found to be effective in one or more well-designated research studies. Now, HPV Vaccination Week has 4 outlined strategies with links to resources available to building out your Vaccination Week goals, and as well as your events. I'll be using the next few minutes to really highlight each and how and why each of these interventions works. And just to note, it's proven that multiple interventions will have the best result. So consider implementing changes on a variety of levels. By using evidence-based interventions, you are increasing the likelihood of success in your work and saving time. You don't need to reinvent the wheel here. I mean, we know what works, and so you can use what works to truly increase your HPV vaccine rates. Now, our first strategy is strengthen provider recommendations. The biggest predictor in HPV vaccination uptake is an effective recommendation from a healthcare professional, specifically a family medicine doctor or a pediatric professional. A recommendation from a healthcare professional is the single most persuasive reason children get vaccinated. Provider education should focus on recommending HPV vaccination on the same day, in the same way as other vaccines. And while it's crucial to have all health system professionals engaged, an effective recommendation from a parent's primary care provider is a key requirement for vaccine uptake. Many parents trust their child's doctor and would choose to vaccinate if they received a strong recommendation. And evidence shows a clinician recommendation plays a crucial role in getting parents to accept HPV vaccination for their children. Therefore, provider education means training providers and clinical staff on how to offer an effective recommendation for HPV vaccination to the parents of adolescents. In 2013, the percentage of parents who reported receiving a recommendation for the HPV vaccine increased. And now it's concerning that approximately 1/3 of these parents were of girls, and over half of the parents of boys reported that their clinician had not recommended the HPV vaccine. The lack of clinician recommendation among the parents of boys might reflect knowledge limitations among clinicians because the recommendation for routine HPV vaccination for boys has only been in place since December of 2011. So, how do we educate providers and staff? It's easy. The handouts from today, which I'll email you tomorrow, you'll find the provider education and You Are the Key CME training fact sheets. These documents are highlighted and a great resource for provider education. This training was developed by the CDC as well as the Oregon Pacific AHEC, and it works to provide key trainings in all settings, and they take care of CMEs and evaluations. In a nutshell, you can contact the Oregon Pacific AHEC and coordinate a free You Are the Key CME training for one or more of your locations. You Are the Key presentation offers an up-to-date information on HPV infections and diseases and the HPV vaccine recommendation and ways to successfully communicate with parents and their patients and their parents, about HPV vaccination. Any licensed professional can deliver the training, but we typically engage with MDs and OBGYNs. Outside of the You Are the Key, the CDC has several resources for providers, including a dedicated website for healthcare professionals on HPV vaccine resources, a tip sheet for talking about the HPV vaccine with parents, and continuing education programs for pediatricians and family physicians regarding the clinical impact of persistent HPV infection and the importance of vaccinating adolescents between the ages of 9 and 12. To improve public acceptance of HPV vaccination, the CDC continues to use research data to create an evidence-based communication campaign to reach the targeted audiences, parents, and providers. And I'm hoping you're taking notes and to look at your calendars for scheduling. And if you've already hosted a You Are the Key training, then I encourage you sharing in the comments about your experiences. And as I stated at the beginning of this webinar, this is a collaborative training, and we want to hear from you. The next intervention for HPV Vaccination Week is developing or improving your client reminder system. Immunization reminders and recall systems are cost-effective methods whereby children in need of vaccination are identified and contacted to come into the physician's office. It has been determined that parents often do not know the vaccination status of their children, and clinics sometimes perceive coverage among their patients as higher than it actually is. So reviewing the data is an important step in starting a client reminder or recall system. And if you find a discrepancy between your initiation and completion rates, that can be an indication that a recall program is warranted. In the next few slides, we'll discuss resources and options on using this intervention method. Now, there are many different methods for communicating reminders or recalls, and these include paper mailings, short phone calls, text messages, and more. And before choosing a method, it's important to understand what would be best for your clinic population, as well as the amount of time and resources your clinic is able to devote. The chart below compares common methods, their advantages, and things to consider when using them. But remember, the best method is always what is your patient's parents prefer. Now, preparing your systems to successfully implement recall and reminder systems, changes need to be seen on a clinical level. Start your project on a small scale with a plan, do, study, act cycle, and expand once you're successful with that. A sample PDSA for childhood immunizations is available from the American Academy of Pediatrics. There is also a great steps guide from the ACS you can utilize in this work. It's important to know that your current HPV vaccination rates in order to know the immunization gap in your recall reminder system is targeting. This will allow you to access which recall or reminder method will be most preferred by your clients and your clinic's best use of your time and your resources. Your process will be most successful if you incorporate multiple communications. Send a letter as an initial notice, then follow up with a phone call. It's also important to ensure that all staff, including administrative staff, understand clinic guidelines for HPV vaccination, that HPV vaccination is cancer prevention. If possible, use technology to support reminders. Electronic health record systems can produce reports to track which patients are due for each vaccine dose, and in some cases can create mailing labels. If you have this, use it. Now, research shows that by addressing barriers, we can increase HPV vaccine use and protect children's health. To be most effective, efforts to increase HPV vaccination use need to consider different concerns of different groups within a population. Some barriers include parent and provider vaccine education and increasing appointment accessibility. HPV Vaccine Week is during the back-to-school season to help with this. It's also important to recognize internal barriers. Efforts that address system-level barriers to vaccination may help increase overall HPV vaccine uptake. The CDC released a study, and these are the findings to identify barriers to HPV vaccination. First, parents often say they need more information before vaccinating their children. Many parents who got their children vaccinated say they did so because a doctor recommended it. Now, healthcare providers often say that parents are concerned with the cost of vaccination, and that made it difficult to provide the HPV vaccine. Many parents and healthcare providers don't see a need to vaccinate boys, and parents whose children start the HPV vaccine series might forget or might not be aware that their children need to receive 2 to 3 separate doses of the vaccine. And this slide just shows similar findings from the earlier studies. It shows why people chose to vaccinate their girls and their boys. And what I want you to take away from each of these barriers is the value and importance of education. If we educate providers on giving a strong recommendation, we can educate providers on how to talk to parents about the importance of an HPV vaccination. And imagine the difference that could be made in these charts. By addressing the barriers found in this report, we can increase HPV vaccine use and protect children's health. For every example, doctors should check teens and preteens vaccination status at every visit, including acute care visits, to make sure they're up to date. Doctors and parents need to be educated about the importance of vaccinating adolescents before they become sexually active. And healthcare professionals may benefit from guidance on how to explain the HPV vaccine recommendations to both parents and patients. To be most effective, efforts to increase HPV vaccine use need to consider the different concerns of different groups within a population. Now, to elaborate on some of these strategies for reducing barriers, is reducing what we call missed opportunity that has the potential to be extremely impactful. Now, to clarify what a missed opportunity is defined as in healthcare is an encounter where at least one vaccination is given, but it wasn't the HPV vaccine series. It's thought that when clinicians use every opportunity to recommend HPV vaccines and to address questions from parents, it can help increase vaccine uptake. This slide illustrates the impact of eliminating missed opportunities and what could happen to your patient population. The figure on the right shows actual and potential achievable vaccination coverage of HPV vaccine if missed opportunities were completely eliminated. Had an HPV vaccine been administered during healthcare visits when they received another vaccine coverage for more than one dose could have reached 91.3%. And an interesting fact that I learned at the HPV Vaccine Summit had to do with the one-shot patients. And it's hypothesized that patients who only receive one shot per visit, instead of getting the complete series, will never complete their series, period. And I found that to be extremely interesting and important, and made me also think of the COVID-19 vaccine, which if you're getting Pfizer or Moderna, is important to get the whole series. So in this case, if a patient so it's incredibly important that patients get the entire series. Now, in short, when it comes to reducing barriers, education is the key. The CDC recently reported that adolescents in rural areas are less likely to be vaccinated against HPV cancers than teens in urban areas. And if you can recall the county coverage slide from earlier, it proves that this study is true in Oregon as well. In 2017, the percentage of adolescents who received their first dose of the HPV vaccine was 11 percentage points lower in rural areas when compared to urban areas. And because of this, one of the elements of HPV Vaccine Week is to reach rural populations. We want to be able to understand why and build a plan that works for our rural healthcare networks. It's thought that the difference may be that there are fewer pediatricians in rural areas when compared to urban areas, or that clinicians in rural areas serve a broader population base and may be less familiar with adolescent vaccination recommendations or may be less likely to stock all recommended adolescent vaccines. So again, education is key for community, clinic staff, providers, and beyond. We need to know that the coverage options by community and utilize resources available to us. Protection against HPV-related cancers will continue to increase if adolescents and their parents are educated about the cancer prevention benefits of an HPV vaccine, and clinicians consistently recommend and simultaneously administer other vaccines. And our final intervention is clinical champions. Having an HPV vaccination clinical champion who advocates for practice change is an important component to the initiation and sustainability of efforts to increase HPV vaccination rates. This individual will serve in a sort of leadership role for the program and on the QI team. When you are working to identify your clinical champion, we recommend that they should be someone who's enthusiastic about the work, have the authority to implement practice changes, and have a scheduled administrative time guide to guide the initiative, to ensure full coordination, and consider multiple and you could even consider having multiple champions. That is, one could be medical, one administrative, or a champion in each of your locations. The role of a champion is to educate other healthcare professionals, discuss HPV vaccination with parents, and make necessary changes in your practice to improve HPV vaccination rates. You'll find a great toolkit of resources that's linked on this slide from the American Academy of Pediatrics. When it comes to prioritizing HPV vaccination in your clinic or system, these are the recommended ways for engagement. First, schedule grand rounds on HPV cancer prevention, or host an all-staff, all-provider training using You Are the Key. Form quality and improvement team. Bring together a group of people to investigate data and barriers, meet regularly, and build out a goal for improving HPV vaccination rates. Educate all staff on HPV vaccination. This is not just a task for providers. Everyone has a role in this work. It's important to engage and educate everyone on the key messages of HPV vaccination. Remember, education is one of our key components. And identify external support. Who else can you find who's active in this work? Are you working with your public health department, the ACS? Are you receiving emails from the Oregon Pacific Area Health and Education Center on the many learning opportunities for HPV vaccination? Did you attend the Oregon HPV Summit last year? Are you interested in joining a state task force? We have resources for that. And do not do this work alone. When you succeed, share it. We want all of this work to be completely collaborative. And our fourth goal is to raise awareness on the importance of HPV vaccination in your community. How can we get this message across? Do you have to come up with your own communication plan? And what is the messaging that you should be using? But don't worry, we have the tools designed for this work. First, here is where we are available with available marketing resources, Ideas and thought starters you can use in your social media activation. You could share the video PSA and tell stories of HPV cancer survivors in your area. You could use videos from HPV cancer experts. You could host a Facebook Live interview or webinar with an oncologist or OBGYN to talk about HPV cancer prevention. You can follow the ACS accounts on Facebook, Twitter, and Instagram and repost content. And we really encourage you to use the hashtag Oregon HPV Cancer Free. It's as easy as sharing a fact about HPV cancer prevention or vaccination, or sharing why you're inspired by the mission HPV Cancer Free Vaccine Campaign. And you can find a plethora of resources on our website. And be sure to follow the Oregon HPV Cancer Free on Facebook, like, comment, and share our content. And also share posts from the ACS and other valuable partners. But you certainly are not alone in creating and cultivating social media posts. They've already been created. You'll note that we have a few sample tweets here or captions on this slide. And that's just the tip of the iceberg. You can check out the Power to Prevent Cancer content from the National HPV Vaccination Roundtable for amazing social media resources. We also have 2 additional toolkits at your disposal beyond the one which we provide on our website. The first is Immunization Social Media Toolkit from the American Academy of Pediatrics. And these are not specific to the HPV vaccine, but have really good content you can use during HPV Vaccination Week. The AAP has developed guidance to help pediatricians develop social media accounts and sample messages to share. This includes memes, videos, and tweets. Another toolkit available is by the National Vaccine Program Office, and they have data and fact-specific graphics that you can share. And all of these links and resources are available in this slide deck, as well as in the Oregon HPV Vaccination Week Toolkit, available on our website. Now, in addition, the AAP released a whole document within their Champion Toolkit for Facebook and Twitter posts. It offers language on the HPV vaccine safety, paying for HPV vaccines, and cancer prevention specific content. Again, you don't have to reinvent the wheel to make an impact in raising awareness during HPV Vaccine Week. Use what has been developed and help us educate communities by spreading the word. Now, the last goal that we are going to cover today is very resource specific. From print materials to social media posts, partners can access ready-to-use materials, many of them co-brandable. Now, the following tools and resources are available to you for use in your HPV vaccination efforts. Several resources are publicly available, and others can be accessed by reaching out to your ACS staff partner. And if you're not already connected to an ACS staff partner, reach out after this webinar, and we'll be sharing the contact information for ACS and OP-AHEC staff heavily engaged in this work, like myself, like Carmen. Now, we believe that every healthcare professional plays an important role in increasing HPV vaccination rates. 6 clinical and system action guides were developed to encourage providers and support teams, as well as their health systems, to take action today. You can get the To-Go guide for healthcare professionals and systems to increase HPV vaccination rates specific to your practice and enterprise. Now, this page is straight from the HPV Vaccination Week Toolkit. Each of these documents are linked to the resource, and you can find the HPV Vaccination Week Pledge, Toolkit, and many other resources on www.OregonHPVCancerFree.org. We have resources to educate parents and the public, and resources specific to the clinical setting. I'm going to be highlighting a few of these resources a bit more. Our first is Protecting Our Children from HPV Cancers. It's a 1-page visual document illustrating 4 key messages about HPV vaccination. Another important one is Take a Shot at Cancer, which is a 2-page low literacy fact sheet covering the basics about HPV vaccination. We also have Don't Wait to Vaccinate and HPV Vaccination, Just the Facts. In addition to this, we have all the same resources available in Spanish, as well as resources related to COVID-19 and vaccination, if that is interesting to you. And be sure to visit our website, download the toolkit, because the toolkit has each of these resources linked, and our site contains even more. Now, before we can wrap up information on resources, I want to make reference to the Mission HPV Cancer Free campaign, launched by the American Cancer Society in the June of 2018. ACS launched this global public health campaign to increase HPV vaccination rates among both boys and girls by 80% in 2026. As part of Mission HPV Cancer Free, the ACS has created a portfolio of resources that partners can use to educate constituents and promote HPV vaccination. Oregon Pacific Area Health Education Center has partnered with the American Cancer Society since 2019 and created the website, which I've highlighted below and many times during this presentation, as the first of its kind in our state and to serve as an HPV reference hub for all Oregonians. And the last resource is the Campaign Research Guide, which is also available in the handouts. This guide will show you why targeting HPV vaccination rates matters, how we can help you achieve your goals, and provide valuable tools and resources to make engagement as well as results from this engagement easy. On the pages that follow, you will find overviews on engaging in HPV vaccination, work tailored to health systems, partners, and coalition or public health partners, and also background information on our Mission HPV Cancer-Free campaign, as well as resources for HPV vaccination work. So the big question that I think remains for us all is, after hearing all this information and me talking at you for 51 minutes, what can we do right now? So the biggest reminder I have is that we have the resources available for a variety of settings. Look at it, know it, and find what's most relevant to your patient population. The next thing to do is to spread the word. Post on social media, email your system or clinic and let them know, and engage in our Oregon HPV Vaccination Week as an official partner. Now remember, you can sign up to be an official partner by going to our website and signing the pledge. Who needs to be involved in this work? The answer is simple: everyone. Engage and educate your entire team. This is not just for a QI department. This is not just for the community outreach staff. This is for everyone. Additional ways that you can engage are: you can recognize providers that are doing well with vaccination rates and support others in achieving similar success. You can work with your state or local immunization registry, coalition, academic, and other partners to better understand vaccination rates in your community, and perhaps even barriers to better health data. And rally with your quality improvement team and other system staff and leadership to implement evidence-based approaches to increasing vaccination rates, including but not limited to standing orders or reminder recall systems. And support parent or survivor champions in your community who can assist you in spreading a vaccine positive message to increase parental awareness. Feel free to contact anyone on this page, and we will be glad to provide you with the support that you need. Thank you so much for coming to the webinar today and for the work you do to reduce the number of HPV cancers. The American Cancer Society and the Oregon Pacific Area Health Education Center are proud to partner with you. If you have any questions, please leave them in the chat.
Thanks so much, Mari, for sharing all this information with us today. While our attendees are typing their questions, please remember a couple of things. Number one, we will email you the CME CE instructions and YouTube link today. Please claim your certificate, even if it's a certificate of attendance. That way you can complete the program evaluation. Keep in mind that the activity code expires in 1 week. And so you have 1 week to claim your certificate. All our webinars, including this one, are on our YouTube channel, and we'll send you the link as well. Any questions, feel free to send me an email. I'll be happy to be of assistance. This is the activity code, and write it down for your records. Or right now, if you want to start, you can use the QR code and it'll open up the page for you. Remember again, it's www.eeds.com, and the code for this event is 93GO as in Oscar, L as in Lima, D as in Delta. All right, so let's see if we have questions. All right, I don't see any questions right now. I will move on, but remember, if you have any question, feel free to send us an email and we'll be happy to help you. And it's again, thank you to our speaker for sharing their time and knowledge with us. And thanks to all of you for participating today. And you have now completed the session and you may disconnect. Have a wonderful day. Goodbye.